My dear students, welcome to Chips and Game for R.A.T.S. The topic that is displayed on the screen, myocardial infarction, is fairly complex. And in this class, I shall be dealing with the coronary circulation, the gross features of myocardial infarction, what are the autopsy changes, the microscopic changes in a case of myocardial infarction. To this, I shall be adding a list of complications and the laboratory diagnosis for myocardial infarction. This is a fairly detailed one and it can help you well in a case of essay question. With this, I shall go to the detailed analysis of each. First, the coronary vessels. The heart is supplied by two major arteries, the left coronary artery and the right coronary artery. The left coronary is divided into the left anterior descending and the left circumflex artery. And this is the right coronary artery. Any obstruction is reflected in the form of an infarct in the ventricles. So this is the cut surface of the heart. This is the left ventricle, this is the right ventricle. This is the interventricular septum. When the left anterior descending is obstructed, you find that anterior 2/3 of the interventricular septum and the anterior part of the ventricle, left ventricle, is undergoing an infarct. If it is going to be the left circumflex, you find that the lateral part of the heart will be undergoing, or the ventricle will be undergoing an infarct. Whereas if it is going to be a right coronary artery, it will be the posterior 1/3 and then it will be the posterior part of the right ventricle and little bit of left ventricle that will be undergoing an infarct. So we shall be having this distribution in mind. With this, I shall be taking you to the gross picture of myocardial infarction. Look at this one. This is obviously a slice of liver tissue. Slice of the heart showing the ventricles. So this is the left ventricle and this is the right ventricle. And this is the interventricular septum. It is brownish or beefy in color, in which I am able to see a pale grayish white area, which is an area of infarct. So an area of infarct which is very well demarcated. If I look at it carefully in the periphery, there is a darkening because of congestion. This is the classical picture of any coagulative necrosis. And coming to the patterns of the myocardial infarction, it can be circumferential. It involves the entire circumference, as it is seen over here. Or it can be transmural. Transmural means the entire thickness is involved. The endocardium, myocardium, and it extends up to the pericardium itself. Sometimes it can be just restricted to the subendocardial region, as we are seeing over here. In certain cases, there can be multiple focal areas of infarction. So this will be the gross pattern of distribution which you people should write. Transmural, subendocardial, regional subendocardial, and multiple focal infarction. In some cases, you find that here again, it is a little pale, but it is difficult for us to make out. It will take at least 24 to 48 hours for the manifestation of an infarct to be visible to the naked eye. But if a patient dies suddenly, you find that there will be no changes that can be visible to the naked eye, yet there will be a massive myocardial infarction. In this case, I am finding that there is a massive thickening of the interventricular septum, the posterior wall, the anterior wall, and the lateral wall of the ventricles. They are thickened uniformly, which we call as concentric hypertrophy. And since the infarct is not very clearly visible, we used to apply a substance called as TTC, triphenyl tetrasodium chloride. When that is applied to the surface of the cut surface of the heart, you find that all the viable area take up a red color, whereas the infarcted area, they do not take up the color. So the area of infarct can be very well made out by means of the application of triphenyl tetrasodium chloride. This can be one of the MCQs that I usually ask this. vessels. So we have seen the gross, the types, etc. Now, what about the microscope? I would like you people to just recall the normal myocardium. You find that there are all fibers over here, broad fibers, there is a nuclei towards the periphery, and you will be able to make out the striations, cross striations as well. That can be made out. And this is the intervening space. The nuclei and the cellular outline are all very well made out. But as there is an infarct, and in this case you find that it becomes almost homogeneous, no nuclear detail, no striations. It looks like what is called as the city of the dead, but the outline alone is maintained, which is called a tombstone appearance. Later on, you find that multiple stages can be made. Initially, there will be just a hemorrhage. There is a necrotic fiber or multiple bundles of necrotic fibers, and there is just hemorrhage. This is followed by the inflammatory infiltrate, which I am finding as multiple dark blue dots. They are all the nuclei of the neutrophils, which are infiltrating. Still later, I find that there is a greater amount of neutrophils which are there. The fibers become a little dwindled, they lose their outline, nuclei are not seen. And in the still later stages, there will be the area of infarction is totally replaced by the inflammatory infiltrate. This is the adjoining myocardial fiber. And finally, you find that the inflammation is over, the story is over, and after the war, I am finding zones of fibrosis without any myocardial fibers. And these are the surviving fibers that are found within the area of infarct. I repeat this once again. So normal myocardial fiber, outline is maintained, striations and nuclei are seen. Here, nuclear details, striations are all lost, but outline alone is preserved, city of the dead. Areas of hemorrhage initially, followed by neutrophilic infiltrate. Dense amount of neutrophilic infiltration, and gradually the fibers lose their contour. Finally, they are getting replaced by the aggregates of neutrophils, which is still later being replaced by fibrosis. This will be the histology. You can go to the books for the day-to-day development in a case of myocardial infarction. Now, that having been said, what can be the complications in a case of myocardial infarction? This is a mnemonic that I would like you people to memorize, taken from the books of nursing as well as the medical students. Darth Vader, death, arrhythmias, rupture, cardiac tamponade, cardiac failure, valvular disease, aneurysm of the ventricle, it becomes weak and distended, restless syndrome, embolism. There can be a recurrence of the infarct, or there can be a regurgitation by means of valvular incompetence, mainly the mitral. So this mnemonic, I would like you people to kindly buy that. And last but not the least is the lab diagnosis. Sometimes this alone is asked as a question. What is the laboratory diagnosis? When I say laboratory diagnosis, this will be most important. Troponin T or troponin I. Very sensitive in the early stages itself, you find that it is increased. Creatinine kinase, MB isoenzyme. It takes about 24 hours for it to reach the peak. So an early myocardial infarction cannot be diagnosed with it. Also, lactate dehydrogenase. The same problem with lactate dehydrogenase. Number 2 is an isoenzyme that can be used for myocardial infarction. Various symptoms that match myocardial infarction. ECG wave abnormalities. Here, for example, there is an elevation of the ST segment. There is a QRS complex that is being formed. There is a depression of the T wave. So these things, and the Q wave also becomes prominent. These things you people will have to memorize. There is changes in the ECG that can be seen. Angiogram can help us diagnose an early obstruction, and of course the various manifestations. So kindly memorize this, and I would like you people to read this question as an essay, a chart, a short note, a multiple choice question for the Viva OC as well as a specimen. Specimen, a ventricular hypertrophy may be kept, and you will be asked various questions on myocardial infarction as well. The references obviously are Robbins, nothing to beat, and R.A.T.S. So I would like you people to see this. R.A.T.S, I have given a detailed description of myocardial infarction, which is an essay question for all of us. So going back to this, I would like you people to kindly see the normal coronary vasculature. What are the patterns of the infarct? What are the gross patterns of an infarct? How it is being identified? The distribution based on which you have got the 4 different types. What is the normal myocardium and infarcted myocardium? Then the progressive changes you can see in myocardial infarction. In autopsy, early autopsy, how do you identify a myocardial infarction? By means of triphenyl tetrasodium. What are the complications? These are all there. And there will be the laboratory diagnosis. When I say rupture, it can be a rupture of the chordae tendineae, a rupture of the papillary muscles, etc., which can be seen. See you in next class. Thank you.